A very good day to everyone. Today, we will begin a new and important topic under the gastrointestinal system, which is stomatitis. Now, when we think about the GI system, we often focus on the stomach, intestines, or liver. But it's important to remember that the gastrointestinal tract actually begins in the mouth, and that's exactly where stomatitis comes in. By the end of this topic, you will be able to define what stomatitis is and know its types. Understand the causes and risk factors. Describe what happens in the body. Recognize the signs and symptoms. Know how it's diagnosed. Learn the treatment and nursing care. And finally, teach patients how to manage it at home. Let's get started. Today, we will begin by looking into a condition that may seem simple but can have a significant impact on a person's comfort and quality of life: stomatitis. Imagine trying to eat your favorite food or even just speak clearly, but being unable to do so because of pain, swelling, or ulcers inside your mouth. For many individuals, particularly cancer patients undergoing chemotherapy, or elderly people with weaker immune systems, this is a daily reality. Stomatitis is the inflammation of the mucous membrane of the mouth, and it can involve various parts of the oral cavity, including the cheeks, gums, tongue, lips, and even the roof or floor of the mouth. This condition can present in acute or chronic forms and may vary in severity depending on the underlying cause and the patient's general health status. Now that we understand what stomatitis is, let's take a closer look at what causes it. Stomatitis is not a disease on its own, it is a manifestation, a symptom that something is wrong either locally in the mouth or systemically in the body. There are multiple causes, and these can be grouped into several categories. Infections. Some of the most common culprits are infectious agents. Viral, especially herpes simplex virus, which can cause painful cold sores or ulcers. Bacterial infections can occur when normal flora are disrupted or if there is poor oral hygiene. Fungal, particularly Candida albicans, which causes oral thrush, especially in immunocompromised patients. Irritants. Everyday habits or substances can also damage the delicate oral mucosa. Tobacco use and alcohol consumption. Spicy foods, hot beverages, and even certain mouthwashes can trigger inflammation in sensitive individuals. Cancer treatments. Patients undergoing chemotherapy or radiation therapy, especially to the head and neck, may develop mucositis, a painful form of stomatitis due to the toxic effects on rapidly dividing cells in the oral lining. Poor oral hygiene. When oral hygiene is neglected, food debris and bacteria accumulate, leading to inflammation and increased risk of infection. Nutritional deficiencies. Deficiencies in certain nutrients, especially vitamin B12, folate, and iron, can contribute to inflammation and delayed healing of the oral mucosa. Allergic reactions. Reactions to toothpaste, dental materials, or even certain foods may cause allergic stomatitis, with redness, swelling, and burning sensations. Systemic diseases. Finally, some cases of stomatitis are a result of autoimmune or systemic conditions. For example, systemic lupus erythematosus, SLE, Behçet's disease, which causes recurrent mouth ulcers. So, as you can see, the causes of stomatitis are varied and often interconnected. Identifying the root cause is crucial for providing the right treatment and relief to the patient. Who is at risk of developing stomatitis? After exploring the causes of stomatitis, it's important to understand who is most at risk of developing this condition. Certain individuals have higher susceptibility due to their health status, habits, or treatments they're undergoing. Let's go through the key risk factors. Immunocompromised patients. People with weakened immune systems are especially vulnerable. This includes individuals living with HIV, AIDS, cancer patients undergoing chemotherapy or radiation therapy. Their immune systems are less capable of fighting off infections, including those that affect the mouth. Wearing dentures. Poorly fitting dentures can cause friction, leading to irritation and breakdown of the oral mucosa. Additionally, dentures can trap food and bacteria if not cleaned properly, increasing infection risk. Poor dental hygiene. Infrequent brushing, lack of flossing, and not visiting the dentist regularly allow bacteria to accumulate, which can trigger inflammation and infection. Certain medications. Several drugs are known to raise the risk of stomatitis. Chemotherapy drugs, which damage the rapidly dividing cells in the oral lining. Steroids, which suppress the immune response. Antibiotics, which can disrupt the balance of normal flora in the mouth, leading to fungal overgrowth. Smoking and alcohol use. These habits not only irritate the oral mucosa but also reduce healing capacity and increase the likelihood of inflammation and infection. Malnutrition. A diet lacking in essential nutrients, particularly B-complex vitamins, iron, and protein, can weaken the integrity of the mucosal lining and slow down the healing process. Diabetes mellitus. People with diabetes are more prone to infections in general, including oral infections, due to impaired wound healing and high blood sugar levels, which support microbial growth. Now that we've explored the causes and risk factors, let's look at what actually happens inside the mouth when stomatitis develops, in other words, the pathophysiology. Stomatitis begins when the protective mucosal barrier of the mouth, which normally defends against mechanical trauma, bacteria, and other irritants, is damaged. This damage can be caused by infection, chemical irritation, trauma, or even nutritional deficiencies. Once the barrier is compromised, the body triggers an inflammatory response. Vasodilation occurs, increasing blood flow to the affected area. This is the body's natural way of bringing immune cells and nutrients to fight off the irritant or infection. Leukocytes, or white blood cells, infiltrate the tissue. Their job is to attack pathogens and clean up damaged cells. This process results in redness, swelling, heat, and pain, the classic signs of inflammation. In more severe cases, prolonged inflammation may lead to ulcer formation, where the top layer of tissue breaks down. These ulcers can make eating, drinking, and speaking painful or difficult, which can lead to malnutrition or dehydration if left untreated. If the damaged area does not heal quickly, or if hygiene is poor, there is a risk of secondary infection, often bacterial or fungal, which can worsen the inflammation and delay recovery. Let's now look at how stomatitis presents clinically. What do we see and hear from the patient when this condition occurs? The signs and symptoms of stomatitis can vary depending on the underlying cause, but generally, patients may experience the following: redness and swelling of the oral mucosa. This is due to inflammation, often visible on the inner cheeks, tongue, gums, or lips. Pain or a burning sensation in the mouth. Patients may describe discomfort when eating, drinking, or even at rest. Ulcers or sores. These can be small and shallow or large and painful, especially in cases of viral or autoimmune causes. Bleeding gums. The inflamed tissues may bleed easily, especially during toothbrushing or eating. Bad breath. Halitosis, caused by bacterial overgrowth and poor oral hygiene due to pain or discomfort. Difficulty eating, speaking, or swallowing. Painful lesions can make even basic oral functions challenging, especially in children and the elderly. Fever. This may be present in infectious stomatitis, particularly in viral or bacterial causes. White patches in the mouth. This is typically seen in fungal infections, like oral candidiasis, thrush, and can often be wiped off, revealing a red base underneath. As healthcare providers, it's important to do a thorough oral assessment and listen carefully to the patient's complaints. These signs and symptoms can affect nutritional intake, hydration status, and overall quality of life, so early recognition is key. Once stomatitis is suspected based on signs and symptoms, the next step is to confirm the cause through appropriate diagnostic tests. Proper diagnosis helps ensure that treatment is targeted and effective. Here are the main tests used in clinical practice. Clinical examination of the oral cavity. This is the first and most important step. The healthcare provider visually inspects the mouth for redness, swelling, ulcers, white patches, or bleeding. The location, size, and appearance of lesions often give important clues about the underlying cause. Swab or scraping of the lesion. A sample may be taken from the affected area and sent for bacterial culture, fungal stain, e.g., to detect Candida albicans, or other microscopic analysis. Blood tests. These help detect nutritional deficiencies such as low levels of iron, vitamin B12, or folate, which can contribute to recurrent or chronic stomatitis. Blood tests may also help identify systemic diseases, such as autoimmune disorders or uncontrolled diabetes. Biopsy. In cases where the lesion is chronic, recurrent, or appears suspicious, a biopsy may be done to rule out malignancy or precancerous changes. This is especially important if the lesion does not respond to standard treatment. Viral PCR test. If herpes simplex virus or other viral infections are suspected, a PCR test, polymerase chain reaction, may be done on a swab sample to detect viral DNA. As you can see, diagnosing stomatitis goes beyond simply looking into the mouth. A combination of clinical judgment and laboratory testing helps determine the exact cause, which is essential for providing the right treatment. Once the cause of stomatitis is identified, the next step is to manage the symptoms and promote healing. Let's start with the medical management, which usually includes topical treatments and medications based on the underlying cause. Topical treatments. These are applied directly to the affected area in the mouth to reduce discomfort and control infection. Antiseptic mouthwash, such as chlorhexidine, is commonly used to help reduce oral bacteria, maintain hygiene, and prevent secondary infection. Topical anesthetics, for pain relief, lidocaine gel or benzocaine preparations can be applied to numb the painful ulcers or inflamed areas, making it easier for patients to eat and talk. Antifungal agents, if the cause is fungal, such as oral thrush, antifungal medications like nystatin suspension or miconazole gel are prescribed. These are typically used multiple times per day until symptoms resolve. Antiviral medications, in cases of viral stomatitis, especially due to herpes simplex virus, HSV, antiviral drugs such as acyclovir may be prescribed, either topically or orally depending on severity. In addition to topical treatments, some patients may require systemic medications, especially if the stomatitis is widespread, very painful, or associated with systemic infection. Let's go through them. Analgesics for general pain relief, especially in moderate to severe cases. Oral analgesics such as paracetamol, acetaminophen, are often prescribed. This helps relieve discomfort during eating, speaking, or resting. Antibiotics if there is evidence of a secondary bacterial infection, such as pus, swelling, or fever, oral antibiotics may be necessary. Antibiotics should only be used when clearly indicated to avoid resistance. Systemic antifungals are antivirals in severe cases, or when topical treatments are not effective, systemic medications are required. For fungal infections, oral fluconazole may be used instead of topical nystatin. For viral infections like severe herpes stomatitis, oral acyclovir or valacyclovir may be prescribed for better systemic control. It's important to remember that medical treatment must be individualized, based on the severity of symptoms, the underlying cause, and the patient's overall condition. Also, medical management should always be supported with nursing care and oral health education to ensure full recovery and prevent recurrence. While medical treatment targets the cause of stomatitis, nursing care plays a vital role in promoting healing, ensuring comfort, and preventing complications. Let's explore the key nursing responsibilities. Regular assessment: assess the severity of pain, oral intake, and the condition of the oral mucosa on a regular basis. Monitoring helps in early detection of complications such as ulcers, bleeding, or signs of secondary infection. Dietary modifications encourage the patient to consume a soft, bland, and non-irritating diet. Avoid spicy, acidic, or hot foods that can worsen inflammation and pain. Oral hygiene maintenance: promote good oral hygiene using a soft bristled toothbrush to prevent trauma to sensitive tissues. Avoid harsh mouthwashes containing alcohol that can dry and irritate the mucosa. Saline mouth rinses: encourage frequent saline rinses, using warm salt water, to soothe the mucosa, reduce microbial load, and promote healing. Monitor hydration and nutritional status: watch for signs of dehydration, e.g., dry lips, low urine output, and weight loss, especially in patients with poor oral intake. Refer to a dietitian or initiate IV fluids as needed in severe cases. Patient education: educate the patient about the importance of medication compliance, especially for antifungals, antivirals, or analgesics. Teach proper oral care practices and how to avoid triggers to prevent recurrence. Through consistent nursing care and supportive education, we can significantly improve the patient's comfort, recovery speed, and quality of life during an episode of stomatitis. Health education is a key component in the prevention, early detection, and management of stomatitis. By empowering patients with the right knowledge and practices, we can reduce the severity, promote faster healing, and prevent recurrence. Here are the main teaching points for patients. Maintain regular and gentle oral hygiene: brush teeth twice daily using a soft bristled toothbrush, and floss gently to avoid injuring the mucosa. Avoid alcohol-based mouthwashes; these can dry out and irritate the mucous membranes. Recommend saline rinses or prescribed antiseptic rinses instead. Stop smoking and limit alcohol intake. Smoking and alcohol delay healing, irritate the oral lining, and increase the risk of recurrent inflammation and infection. Stay well hydrated. Drinking enough water keeps the mucous membranes moist and supports healing. Eat a balanced diet. A diet rich in vitamins, especially B complex, iron, and folate is essential for maintaining healthy oral tissues and immune function. Avoid irritating foods during active inflammation. This includes spicy, acidic, salty, or rough-textured foods, which can aggravate pain and delay healing. Seek prompt medical attention for persistent sores. Any mouth sore that doesn't heal within 2 weeks should be examined by a healthcare provider to rule out serious conditions, including malignancy. Notify the healthcare team before starting chemotherapy or radiation. Early preventive oral care and dental checkups can significantly reduce the risk of mucositis and severe stomatitis during cancer treatment. As nurses and educators, we play a vital role in reinforcing these practices, helping patients take control of their oral health and preventing complications from stomatitis.